Okay, got it. Okay, good.
Dr. Kishori, thank you so much for joining us today. You are the practice owner and the Chief Medical Officer of Neurology Associates of Texas. We'll start with an easy question for you. How long have you been practicing as a neurologist?
Thanks, Victor. Thanks for having me. I've been practicing for 14 years, so it's been a long time.
Fantastic. Can you walk me through what was your process for clinical documentation before you adopted SteerNotes?
Yeah, so before SteerNotes, my process for clinical documentation was incredibly time consuming. I spent significant portion of my time in taking notes during patient's visit and then dictating and again editing. So it was very time consuming, inefficient. So I'll re-say that, sorry. It was inefficient and led to delayed documentation, unfortunately.
Gotcha. Yeah, that's what we hear on our daily conversations. Now, did you also have a staff member sitting in the room with you, transcribing or doing note taking uh, in your clinic?
No, I haven't used my staff members or scribers. In fact, I utilize transcription services and also there's a newer technology where it's Fluency Direct, which has been great that I can directly dictate into the patient's chart. However, I still have to recall all the discussions that we had with the patient and do a little bit of editing. It does capture a lot of medical terms, but it's nothing like SteerNotes, for example.
Gotcha. Yeah, I'm sure having to recall the encounters is a lot of energy spent on your behalf.
That's right.
Would that work? Go into the evenings at night times for you?
Mhm. Yeah, unfortunately, I've spent like 1 or 2 hours every evening just to complete the patient's notes. Uh, Given the complexity of neurological disorders, I spend a lot of time discussing with the patient the plan of care. I know some providers do transcribe or type during the visit, which is great. But in my situation, I tend to spend more time with the patient and kind of put the documentation to a later date. However, that sometimes can delay the patient care. So I try to prioritize my patients that would need a lot of images or tests sooner than later. So I kind of go by, and of course, with all other responsibilities that I have, with the call, hospital call, and between patient messages and all that. So dictation becomes my, okay, I can do this in the evening. So yeah, typically I've been spending 1 or 2 hours. Well, with SteerNotes, that's not the case.
Gotcha. Yeah, they're keeping you busy now. I'm glad SteerNotes is helping you out. You
Thank
mentioned using previous tools in the past before SteerNotes.
Uh-huh.
What did you like or dislike about the previous tools before SteerNotes?
Sure. Yeah, the obviously the transcription services, they transcribe what they hear, understand, and then I still have to edit on top of it. And with the recent one, I still have to dictate through it and I have to recall all the events or discussions that we had during the patient's visit. So it's kind of recollecting all the memories. However, with SteerNotes, during the patient conversations, it captures everything in real time and accurately. So all the information is captured. We are not missing any patient history or anything related to that. So, which is a huge benefit. And more than that, I think it improves patient focus care, and the SteerNote summarizes very nicely and basically like medications, orders, labs, MRIs, whatnot. And that can be followed through by my staff after I finish the notes. And before the patient leaves, SteerNotes provides full patient instructions related to the conditions, which is a significant value for the patients to follow through on it, and also for my staff to go through and make sure all the tests and orders have been taken care of, which has been a
Wow,
benefit.
that sounds fantastic. Sounds like you were juggling a lot of different components, and with steered notes, right? It's been able to
Yeah,
help your office be a little more efficient. Where do
absolutely.
you see
Thank
that's
you.
great. Where do you see the AI capabilities like steer notes can bring the most value for more clinics that are very similar to yours?
I think the most value is collecting large data from all the patient information, diagnosis, and the protocols, and the way, of course, a lot of times providers have different ways of utilizing medications and all that, but it gives much more information on what are the medications most effective, what are the tests are
Mhm.
needed for certain diagnosis. So the large data collection in helping patient care and also for research, right? Medication research, or those are the huge benefits. And also, in addition to that, the messaging systems and following through on patient care. I think this is going to take to a different level. Of course, AI is not going to replace human intellectual capacity.
Yeah, yeah, awesome. That's fantastic. And what's getting you most excited about the future of technology in healthcare?
I think technology has been so much valuable lately. I think better communication with the patients, faster communication. And of course, with SteerNotes, the patient's burnout, physicians' burnout has been reduced significantly. So you're not spending 2, 3 hours. I would rather spend time with patients than sitting and documenting these notes. So I save a lot of time and I could see more patients, provide, obviously faster care for my patients, definitely.
That's fantastic. So the faster care for your patients, is there, one last nugget that you think generative AI can contribute to the healthcare industry?
I believe so. I think, as I said, it helps to collect more information, and obviously the research area would be more utilized, and we will learn more about, as I think our patients now are able to utilize a lot of these AI related systems, right? Like, and also patients respond better to text messages. Of course, that can create care gaps and
Mhm.
also help the patients to follow through, and it's easier to get in touch with them. So I think, in my opinion, I think this has been a great addition. And of course, the newer providers that coming out of schools will adopt much more than our generation, but I think we're getting there. This is great.
That, that's great. Yes, it is a new age in healthcare. Well, this was wonderful, Dr. Kishori. Thank you so much for sharing your experiences. We know you're a very busy individual provider. Again, thanks for joining us today. If the audience has any questions for Dr. Kishori, feel free to add the questions in the Q&A box below. We'll make sure to have those questions answered for you later today.
Absolutely. Thank you so much for having me. It was great talking to you, Victor. Bye.